This video is for all those family members as well as patients who have gone through some kind of neurological disorder and now they are not able to move around freely because someone in the early phase of the disease didn't take care about their joints or didn't give enough movement. Hi, I'm Siddharth and I'm working as an Advanced Neurorehab Specialist here at PRS Neurosciences. In this video, we are going to speak about three terms. First is tightness, second is contracture, and third is deformity. Okay, and the reason for this tightness, contracture, and deformity is very simple: lack of movement. Fine. So imagine someone who has a stroke, an injury to the brain or the spinal cord. They cannot control their own movements because the brain is not sending enough signals or the spinal cord is not able to carry the signals. Now, because of this, because there is no active movement happening, in the neck or in the back, in the shoulders, elbow, we look at the wrist, hand, same way in the hip, in the knee joint or the ankle joint, that muscle length, the something known as fascia, which connects the muscle and the skin and allows them to be move with each other, and the joint and the structures, like you have heard of this Achilles tendon, which connects the ankle and allows the ankle to move up and down. Okay, so there are many structures like this. Okay, so these words usually the muscle has become tight, sir, or the joint has become stiff, right? So this happens because someone did not move. Right now, why a person is not able to move, which I clearly told, because of lack of signals coming from the brain and inability to control the movement. In absence of these, the muscle, they kind of, the length adapts. Means if today I'm moving my hand through full movement, the muscle will respond and the length will maintain. Imagine for some reason the hand got stuck like this, especially you would have seen in cases of stroke, right? And it becomes very tight and very painful to move. So people don't want to move, don't touch my hand, they start shouting and crying, and then out of sympathy, family members, they won't move it because they'll say, oh, he's already in so much pain, why to move it? That lack of movement is not only stopping the recovery but also complicating this tightness, contraction, deformity related issues. If suppose you have a family member who has a similar problem, you can easily make out what is tight, what is a contracture, and what is deformity. Fine, let me explain you, give me an example of a wrist. Suppose the hand is like this and you are actually able to move it, but the fingers are clawing on your hand like this. You are able to move it, right? It may be tightness along with something known as spasticity. If suppose you are trying to move but you are finding it very tough and the tendon here, it kind of pops out, that is what is called as a contracture, meaning the length of the tendon which is connecting the muscle to the bone has shortened, right? And last is deformity, means at the level of the bone itself they have connected, like you can't even move it. Now, why you as a caregiver should know this is, tight muscles, they can still be elongated gently and they adapt, when you are exercising. Contractures, if the patient has a tendon which is popping up and you're trying to force it and try to move it, you are actually causing more damage. You are actually causing swelling in the tendon, because of which it becomes painful, and that's when the patient, or in your case your family members, they would say, don't touch my hand, and they become very agitated and aggressive. Deformity, when we know that it's at the level of bone and you're trying to overforce it, there's a very high chance you will cause an injury in the bone, right? It may, you may land up causing a fracture, and there may be a bleed which may happen inside. So all these are very it looks very easy to understand, but they are life threatening for some people, because assume that the patient is on blood thinners and you have caused this injury and it starts bleeding inside, it won't even stop easily, right? So this is a complicated situation. Now, how do we prevent it? Early in the phase, when someone who has a stroke, or a traumatic brain injury or a spinal cord injury, or you take any other kind of neurological disorder, it's very important to maintain the body in the optimal position, which may necessarily not be comfortable. Okay, there is a thumb rule: position of comfort leads to tightness, contracture and deformities, which means if the hip and knee are bent and the patient is comfortable, don't think this is right. You need to straighten up the leg on regular basis. For doing that, you don't need a professional to come and tell you. It's because this is a basic science. You maintain the length, he will be ready to engage in future when he starts getting better. Similarly, turning the patient time to time allows the muscles around the trunk, between the neck and the hip. This part is called as a trunk. When you turn them time to time, the muscles and the fascia, which I was telling you, between the muscle and the overlying skin, they keep moving. The idea is, when that is flexible, it allows the person to breathe properly, which means enough oxygen is going to the brain. It allows the patient to be comfortable, reduces the pain which they usually get when they are in the same position lying down for continuously for long hours, and it makes them more flexible and easy for them to learn how to move again. One more important thing which I want to emphasize to prevent this tightness which happens initially, that's the first thing what happens, is proper hydration. Without proper hydrations, what happens is the muscles, they tend to become stiffer. Okay, and when you try to stretch a stiff muscle without proper hydration, there's a very high chance you will cause something known as a micro tears, small tears. It's so small that initially it won't make any difference, but repeatedly when that tear happens, it leads to bleeding. Sometimes even it leads to deposition of calcium, which leads to bone formation in the muscle. These are some things which is very important for the long-term recovery. Okay, the most important thing what I believe to prevent this tightness, contracture or deformity is to believe that at a given point the person is going to recover and become ambulatory again, because majority times we think that because he is bedridden now, this is what his life is. What's the use of doing so much exercise or so much mobilization or so much movement every day, because nothing is going to happen. It's not always the case. When the person actually comes to a phase where he is ready to engage, at that time, if the ankle is stuck, he can't place the foot properly, or the hand is stuck, muscles are wasted and he can't move properly, that's the worst part. Because someone who's bedridden for a long time, okay, you can take care. When someone becomes ambulatory and the joints are not okay, how are you going to take care of it? So who is answerable for that? So these are some things which important in this context of tightness, contracture and deformity. Now, tightness, yes, with stretching, as I told you, the length can be maintained. Contracture usually does not respond to conservative management. So you should go and consult orthopedician for that, because it's a local tendon issue. So sometimes they will go for tendon lengthening. Right? Tendon lengthening surgeries are done so that it allows the joint to move through the full range. If it is a deformity, the bone, there's an excision surgery which is done so that the joint can be realigned again and some amount of functionality can be provided. Instead of the foot being completely down, they would work around the ankle joint and see if how much can they move the joint properly. So all these things are options which are available out there. If the spasticity, which is the reason what is causing all this, simple solutions: Botox, proper neurorehab, regular use of the limb, it actually helps to ameliorate some of these issues. At the end of this video, you would have understood it's not just thinking that the brain is damaged, it's also keeping the body future ready, so that when the brain recovers, the person who has suffered through the damage can reintegrate back in the